Good morning, Acting Secretary Klinepeter, Dr. Johnson, members of your team, thank you for being here today. And I want to start my time with you, hopefully, to receive an update from your department on the massive data breach that occurred between your department and Insight Global, which was the entity that you hired with a no-bid contract to conduct contact tracing here in the Commonwealth. 72,000 Pennsylvanians, including our children, had their personal information compromised. Last week, when the Attorney General sat in that very seat that you are sitting in, he said, and I quote, "I consider this to be a serious data breach. I can't, in this setting, get into the status of our review of it." So I am hoping that you might be able to shed some light on what your department has done to rectify the situation with the tens of thousands of victims, including our children, as a result of this data breach.
So I would offer that we do not refer to it as a breach. It is a data incident. And so the contractor who was responsible for this incident, who had staff members that operated wildly outside of the parameters of the contract that we established with them, was entirely responsible for the data incident, and the Department of Health has held them accountable for it. So to establish the facts, there were certain employees who were employed by Insight Global that kept information on unauthorized technical capabilities. And as a result of that, there was concern that there was information that was personally identifiable that could have been released, and it was actually 76,000 individuals who were impacted. In response, I want to be clear that no Commonwealth IT systems or the mobile application that the department developed to alert people if they had been exposed to COVID-19 were compromised. Again, these were IT systems that the contractor was responsible for establishing and maintaining, and there were employees who were not using those authorized systems, but that in no way touched any Commonwealth IT or mobile applications. We, per the terms of the contract, Insight Global was required to retain an IT forensics firm to ascertain exactly what information had been exposed. The department required Insight Global to notify all impacted individuals. They were required to open a toll-free hotline, which they did on April 30th, 2021, and that was open until the end of September 2021. There was no financial information that was included in the information that was inappropriately stored. However, we did offer free credit monitoring and identity protection services to anybody who was impacted at absolutely no cost to them. As of July 2021, there were 453 individuals who signed up for those services. The department had a contract with Insight Global that ran until the end of July 2021. We did terminate that contract early on June 18th, 2021. In the interim, we had the Pennsylvania National Guard do COVID mapping, which is the way that they like to refer to contact tracing, until we had a new vendor, the PCG, Public Consulting Group, who has come on board and is now doing contact tracing for us. I'm happy to discuss the differences in the way PCG is operating compared to Insight Global, but happy to answer any questions.
Well, thank you. I appreciate hearing that timeline from you. Has the department implemented any changes that will prevent something like this from happening in the future? And if so, what are those changes? And again, this also was another no-bid contract? Am I correct?
That is, it was done through an emergency procurement, but there were a multitude of vendors that were evaluated. So the department, over the course of COVID-19, I have the exact numbers, but has done roughly 60 emergency procurements, some of which are still open, some of which are closed. And we have done those given the time sensitivity. So for example, when we terminate a contract 6 weeks early, we still need to be able to provide capability to the citizens of the Commonwealth. And so we went through actually a very rigorous process to identify a different vendor. So we had several criteria that in combination we used to choose a vendor. We used what's called an RFEI process. That's where we do an emergency procurement, but multiple vendors are evaluated based on the same criteria. And then an expert group within the department selects the vendor. And we do get approval from DGS to then move forward. So the key criteria that we used when evaluating our new contact tracing vendor included experience conducting this work in more than 5 states, experience in a border state to Pennsylvania. They needed to already be on the Pennsylvania registered supplier list, so they were a vendor that we knew based on experience in another agency was trustworthy. And then they needed to have an existing contract with another state agency. In total, we evaluated 7 different vendors. We ultimately, based on those criteria, chose PCG. We mostly chose them because they were working in 6 other states, 2 of which were border states, and our state epidemiologist, who's responsible for overseeing contact tracing and case investigation, reached out to all of the other state EPIs, and PCG came very highly recommended. So again, I want to emphasize that Insight Global, the employees at Insight Global acted outside of the parameters of the contract that we had established with them. So when we entered into a contract with PCG, we did ensure that there was additional training requirements that were put in place. We provide actually a significant amount of that training, which is required to anybody who is working on contact tracing in Pennsylvania. We also put in place some changes to the IT systems that were allowed so that we maintain software systems that have things like timeout features to improve the security of them, and other restrictions to ensure that staff don't inadvertently release sensitive information, such as the use of a VPN or a virtual private network. And so there are stringent requirements in place contractually, but again, the Insight Global employees acted outside of the contract, which is why we terminated with them.
Thank you. So when you crafted that original contract, there was no consultation with the technology experts in this Commonwealth, the Chief Information Officer, the Chief Information Security Officer, if I recall correctly. When you...
I don't know that to be correct.
Okay. And
typically when we establish an IT contract that goes through rigorous review, both at the Department of Health legal and IT levels, and then at the governor's office level as well, so we can check who specifically reviewed that contract.
That would be very helpful, because the information that we had received previously indicated that there had been no consultation with the technology experts in this Commonwealth. When you enacted the PGC contract, did you have it reviewed by the technology experts in the Commonwealth?
Yes.
Okay. Finally, is there still a contact tracing contract with PGC and the state? How much is that contract for, and what is your plan moving forward?
Yes, there's a contract. It has a $35 million ceiling. The original PO was cut for $9 million. I believe expenditures to date are $4.8 million. That contract goes through the end of July at this time. It does have options to extend. We are in the process of evaluating how we want to shape that contract moving forward, given updated guidance from the CDC with regard to who should, what specific areas should be contact traced and case investigated. For example, there's new guidance from the CDC that says we should really focus on particularly vulnerable populations, such as those in our long-term care facilities, and to not engage in contact tracing more broadly, but our team is still reviewing that guidance and determining how to implement it at a state level.
Thank you.